Joining me now is Federal Health Minister Patty Hajdu. First of all, Minister Hajdu, thanks for joining us.
Great to be here, Martin.
Now, you've seen your own advisory committee's recommendation that you scrap the mandatory quarantine hotels for air travelers arriving in Canada. What's the government's response? Is the government going to phase them out?
Well, obviously, at some point, we'll phase out the mandatory hotel requirements, but we're working right now with Dr. Tam and the officials at the Public Health Agency of Canada on a safe roadmap for the borders. And of course, with increasing rates of vaccination here and indeed around the world, we're starting to see options unfold for how we reduce some of those requirements at the border. And if this report really helps us plan that roadmap in a safe, cautious, and prudent way.
Okay, but and you don't need to be reminded of this because you hear this in Parliament every day, but they're pointing out the system doesn't apply to people crossing by land. Many people are paying a fine where it's applied. It's not applied in two jurisdictions, or they're not staying in the hotel, or they're taking flights to border points in the U.S. where they can walk or take a taxi across the border. But more importantly, the committee tells you that you're wasting precious resources trying to do this quarantine hotels. Wouldn't it be time to actually shut them down, stop it?
Well, as I said, Martin, that's exactly what we're working on now with officials through the Public Health Agency of Canada and, of course, with the leadership of Dr. Tam, is a safe and prudent roadmap for reducing some of the quarantine measures and some of the measures at the border. Listen, we'll have measures at the border for quite some time. We know that this virus, although we're starting to see domestic control of the virus, we still have jurisdictions where there are high case rates and struggling healthcare systems. We still see, lots of Canadians stepping up for dose one of their vaccine, but we've got a ways to go for second doses. And of course, the international scene with the virus is still in a precarious place, including the growth of variants in otherwise, I would say, stable countries. And so we take the report. We're grateful for the report. Listen, I am very thankful we have experts and scientists guiding us on this next step because, as you point out, it's complicated and we need to do it properly.
Okay, but in a word, is this part of your possibilities, and when might we know if you're going to close the hotels?
Well, absolutely. I mean, listen, I think anyone would understand that we're not going to have the requirement to quarantine in a government hotel forever.
But they're asking you to do it now. I'm just wondering if you're ready to make a decision now or to act on the recommendations.
I think we'll have more to say after we assess the report, look at the operational considerations, speak with the provinces and territories, of course. As you know, Premier Ford, for example, is actually asking for stronger measures at the border. So it's important for us to understand how we move forward carefully and cautiously together. This is a Team Canada approach, and we want to make sure that the next steps that we take are in no way going to jeopardize the recovery that we're seeing in our country.
Any time frame on that?
We'll have more to say in the days and weeks to come.
Okay, let's talk about AstraZeneca vaccines. I know you invited the provinces. There are tens of thousands of doses of AstraZeneca vaccine that are set to expire on Monday, May the 31st. You've asked that any province that might be facing difficulties in getting doses into arms contact you, the federal government. I know that Newfoundland has sent you some doses. Have any other provinces told you that they are not going to be able to do it and asked you for help in the logistics of maybe transferring it to another province?
I haven't heard yet from other provinces. Perhaps my officials have, but they haven't updated me on that yet. I certainly was clear in my letter that there is an opportunity to move doses around to provinces in particular that are planning on using doses for second dose delivery. And we'll continue to work with provinces and territories in this critical mission. Listen, I think, many provinces are moving towards second doses. Obviously, AstraZeneca, people like me who have received AstraZeneca, especially in the earlier months, are eligible for a second dose. AstraZeneca has a 12-week spacing requirement. So we're watching all those deadlines closely and managing supply so that we can best get it into arms.
Okay, the vaccine passports. About 3 weeks ago, you told another interview that you are working on it. It's a live issue, as your officials now say. You're working on them. Any idea when you might have an announcement of when vaccine passports, this is for international travel, might be available? Because so many of the reopening programs and the report that we just saw from your advisory committee on testing and screening all depend on vaccine passports. When might you have an announcement on that?
Well, there's a proof of vaccination and there's vaccine passports. And of course, working on some sort of international standardization approach is exactly what's happening with the G7 and other international bodies, including advice from regulatory bodies that deal with transport. So this is really a whole of government approach. Of course, Minister Mendicino and Minister Garneau and others are actively involved in this file. From a health perspective, my role is to work with provinces and territories to ensure that there is a way to share that data while respecting the privacy considerations of Canadians in those jurisdictions. And we're having very good conversations with provinces and territories on that very thing.
On that front then, because I mentioned the reopening plans that we're seeing of so many provinces, so many depend on travel between provinces even, depending on, as you say, proof of vaccination. Are you any closer, and do you have a date in terms of when there may be, at least between provinces, a federally accepted and coordinated proof of vaccination certificate or passport?
Well, travel between provinces is actually within the jurisdiction of the provinces to determine what proof might look like. Certainly with the ArriveCan app, we can upload documents, as you know, including, for example, test documents and vaccination proof. But in terms of domestic travel, provinces and territories are free to choose whatever proof it is that they would require. For example, when I was immunized, Ontario provided me with a PDF that I can print out of my first dose of AstraZeneca, and that may be sufficient for other provinces and territories to accept as proof of vaccination. My role is really not involved in those types of interprovincial travel decisions, but rather the decisions around the international travel and what types of proof of vaccination that Canada would accept for entry, and of course making sure that Canadians are ready to have proof of vaccination when the world resumes a more robust international travel landscape.
Right. As you know, the international travel, the entire travel industry is waiting on that. I don't know whether you gave me a date in terms of when you might be able to announce the international vaccine passport.
I don't have a date for you, okay, Martin, because of course this work is in progress, not just with Canada, by the way, but right, internationally. Okay. And so again, this is standards work that takes time.
Can we talk about the reopening plans that we're seeing across the country? Now, the majority of provinces have now released their reports. Many of them are extensive, and they go all the way to a complete removal of almost all measures. For example, Alberta, by July, they're foreseeing, if everything goes well, that they will have removed almost every public health restriction. Do you have any concern when you look at some of these measures, which are going further faster than the Health Canada guideline of 75% first dose and 20% of second dose?
Well, what I would say is that it's important that as decision makers that we do follow the public health advice and evidence of the many scientific tables that are advising all of us. I know that's hard sometimes because, of course, there's difference of opinions, but the tables themselves actually work through those differences and then provide very robust advice to the governments to implement. I think it's very important also to look at the historical advice of the modelers. I mean, at the very beginning, if you remember, the models, those very first models said that if you released measures too quickly, before you actually had the virus subdued, you would see in some cases resurgence that was worse than the first wave. That's exactly what we've seen. So it's really important that we take it cautiously, that we assess our own epidemiology in each jurisdiction, and provinces and territories will know best what their capacity is from a testing, screening, and from a healthcare system perspective to be able to manage those outbreaks. That's really critical, Martin.
Okay, but in a nutshell, is there a concern there? Because every time the Prime Minister has addressed this issue, he's looked straight at the camera and had a message for the provinces, and that is, don't do any of this before your caseloads come down. Is there a concern on the part of the federal government?
Well, I would say there's a concern if measures are lifted while there is not the capacity to test, trace, and isolate, indeed to take care of people that are sick. And I would say that some of the measurements that some provinces chose during the last wave, namely ICU admissions, obviously clearly turned out to be quite dangerous and flawed. So, you know, what our expectation is that provinces and territories follow their own data, their own science, and are looking at measurements that include things like case growth, capacity to test, the ability to keep up with contact tracing, and the vaccination coverage of their population. And that's how we all indeed move out of this more quickly. We can see that even having one province in surge puts an enormous strain on that particular province's health system, and that puts all Canadians in that jurisdiction at risk, not just those who are sick with COVID.
Okay, Minister Hajdu, I want to thank you very much. Thanks for taking the time.
Thank you very much, Martin. Great to see you.